gentlemen, good afternoon and welcome to our third and penultimate webinar session of the season, dedicated today to the Hospital of Morges and to the Oncological Department. My name is Ingrid Cravoisera and I'm the Administrative Director at Swiss Medical Gate. Before giving the floor to Dr. Rham, the CEO of Morges Hospital, I will shortly present you Swiss Medical Gate, and Ina, our interpreter, will simultaneously translate. Swiss Medical Gate is an independent international medical coordination structure, whose general management has a background of over 20 years within the medical field. We are accredited by most of the university hospital, the
We have a problem.
We don't hear you anymore.
Here we are.
Okay, I'm sorry. Something went wrong. So I don't know where it stops actually. So the doctors are most in Switzerland are independent, which give us the way his way of working, because we can choose them, and he has the choice to operate wherever he wants. And this is what Swiss Medical Gate is exactly looking for the patient. We always search the best patrician because this is what is important to us and for the patient. We could work together due to our multilingual team case manager. Swiss Medical will process to your demand with the best specialist. We send you the relevant quote, and if accepted, take care of the administrative aspect of the patient, such as visa, laissez-passer, hotel, transfer, translation, anything that will make it easier for him. With our team, we will respond to your medical demand within 38 hours, and the patient will be taken care by the case manager from the moment of his arrival through the medical stay until he leaves home. We also obviously take care of the follow-up, either us, either the doctor. We don't leave the patient going home and doing nothing afterwards, just leaving by himself. Of course, if necessary and needed, we work with interpreter. They are also accredited to our structure, and they are there to facilitate and ease the patient's stay. Our goal is, first of all, to satisfy you, but above all, we are listening to the patient's request and make him our main priority. I don't know if you've seen it, but our main slogan is patient first, and we try to do our best to do it this way. Now, coming back to the webinar, and according to your choice, you have the possibility to leave your question to the doctor and to Mr. Rham, and please, if you can, do it at the end of the presentation. You can do it orally or writing. This is up to you, but please feel free to do it. And we will have just a recommendation, please. We kindly ask you to turn off your microphone and turn off your camera. Meanwhile, the presentation are on. It's just for the smooth running of the webinar. I now hand it over to Dr. Rham, who will present you the Hospital of Morges, and I wish you a very pleasant webinar.
Here we are. Good morning, everybody. Thanks at first to the Swiss Medical Gate to invite us to this webinar. My name is Mikael. I am a physician and the CEO of this hospital called Ensemble Hospitalier de la Côte. The abbreviation is EHC. I have been working in this institution for almost 15 years now. I am going to present you the main elements of our institution. This photograph you can see on this slide of the hospital is not a fake. The localization is really beautiful. The hospital is located in the middle of the vineyards facing the lake and the Mont Blanc mountain. Our hospital has a long history. 2 years ago, we celebrated its 150 years. It is a very well-known hospital in the region. The hospital is located between Lausanne and Geneva, two big cities in Switzerland, on the lakefront. It is located about 30 minutes from the international airport of Geneva. This hospital takes care of about 200,000 people. The hospital has about 15 sites spread throughout the region. The objective is to offer the population a response close to their home. One of the particularities of this hospital is that it includes 4 complementary missions that ensure continuity in the follow-up of the patients. The hospital is a care network with general medicine, acute care, rehabilitation, and long-stay care. This complete network organization is unique in Switzerland. This organization offers continuity of care with the right patient in the right place at the right time. This hospital also has a VIP clinic or a private clinic on the top floor with a private area. The satisfaction of the private patient is now really high. The hospital has 200 physicians and 40 medical specialties. On average, inpatients have in our hospital 5 diseases. It is therefore very important to offer medical follow-up by several medical specialties. We observed this with the coronavirus. The patient suffered from respiratory disease, but also from digestive, cardiac, and nephrological problems. I can say that we offer a very specific medical follow-up. It is the chairman of the service who takes care of the patient in the private zone. The medical specialties are present 24 hours a day. The technical platform is ultra modern with 10 operating rooms, including urology, analgesic, proctology, and endoscopy room. In addition, the hospital has a cath lab for cardiac operation. The comfort is also maximum. The particularity, of our offer is its reasonable cost that we can propose. I want now to present you a fantastic physician named Oxana Shestaeva. She is an oncologist we are very proud to have Oxana Shestaeva on board. Oxana, I give you the floor.
Okay, thank you, Michael. So here we go. Good afternoon, everybody, and thank you so much for having me. I'm Oxana Shestaeva, I'm a medical oncologist. I'm very depressed right now, so I'm sorry for my switching French into English and stuff. So, well, basically, I'm very, very happy to be a part of this team in our Department of Clinical Oncology and Hematology here in Morges. My colleagues, we're 5 doctors actually, are very caring, professional, and dynamic English-speaking doctors. I myself graduated from 2 medical schools, one in Siberia, in Russia, and one in France, where I studied for 7 years oncology within a postgraduate program, which now gives me the complete diploma recognition and the practice authorization here in Switzerland. What we can do for you and your oncological condition, we can do lots of things.
Dr. Shestaeva, I'm sorry to interrupt you. Can you just let me know when you want me to go further?
Sorry.
Thank you. Thanks.
Well, our common goal is to take care of our patients here in Morges, from the diagnosis till the best supportive care or palliative care. We are able to treat following international guidelines, ESMO guidelines or ASCO guidelines, all types of solid tumors and hematological malignancies. We have extensive experience in the diagnosis and treatment of every kind of cancer. We work together, of course, with a team of doctors and some subspecialists in other areas to determine the most appropriate treatment and options for you and your individual needs. Next slide, please. In terms of types of cancer treatment, it depends, of course, on your condition and how advanced it is. We provide different kinds of cancer treatment and combinations. Here in Switzerland, we prescribe and manage the most recent, I would say, drugs and immune therapy directly after the FDA and EMA approval. In lots of cases, the treatment is a combination of surgery, which can be provided here in Morges, and complementary treatments, either chemo and or immune therapy and or targeted therapy. Radiation therapy takes a big part, of course, of the treatment. It's performed in CHUV in Lausanne using the most recent technologies as CyberKnife, for example. Next slide, please. We have this very honorful and huge possibility to collaborate with CHUV professionally, and we're very close geographically to this one of the world's best university hospitals. We have the possibility, for example, to discuss a patient case in CHUV with the professor and specialists when an academic point of view is needed on the patient's condition, whether it's rare or very severe. Now I think maybe you know that, for example, the DNA sequencing is a standard of care. We have this possibility to perform this kind of analysis within the Rham Cancer Network. So we perform on basis of tissue samples and biopsies, either 52 or 400 genes sequencing, and then we can discuss if we are to give some drugs on the druggable mutations found. You have to know also that Morges Hospital is a part of the Rham Breast Cancer Center. It means that every patient receives a high standard double control treatment and diagnosis following the newest and the most recent guidelines. Well, there are many clinical trials that are conducted in CHUV. We are able to give you the orientation well needed to be a part of a clinical trial, for example. There are some very modern and popular and promising clinical studies in the field of cancer vaccination, for example, or TIL-ACT therapy. Next slide, please. Next slide. Hello? Hello?
There is no more than those, actually.
Hello?
Can you hear me, Dr. Shestaeva?
Yes, I hear you, but where is everybody?
I have no more than those slides. I had 5 in total,
Yes,
that's all.
this is the last one. Yes,
Okay.
it's okay, but just I wasn't seeing it. So I thank you very much for your kind attention. And now I'm ready for questions if you have any.
I'll switch off this and I'll see if there is any question that has been on the screen. Is there any question on the side? I don't have anything. Marina, do you have anything on your side? Or Alex, do you have any question from your side? No question on this side, okay. And Marina, do you have anything? Doesn't look like. Well, I would like to thank you all for your participation. Thank you, Dr. Shestaeva. Thank you, Dr. Rham. We'll remind you that our next webinar is going to be on the 10th of June. You will receive the information as usual previously to that. And I do hope that you got the information that you were looking for, that you had an interesting webinar. And thank you for coming. Thank you for listening to us, and see you soon. Take good care. Thank you. Bye.
Thank you.
Goodbye.
Bye.
Thank you.
Thank you.